CBS 12's Andrew Lofholm reports on how an old technique meant for the heart is now being used on the feet.
If you've ever been along the water near downtown West Palm Beach, you've seen Lee Shepard's work. He planted these mangroves 8 years ago with the help of the county's Environmental Resource Management.
This was a 50-foot deep muck hole, dead zone, zero sunlight penetration. We put in islands, we planted mangroves. It's a tidal lagoon full of sea life, full of life, thriving ecosystem. He's a healer and an innovator. He's used his patented reef restoration system in over 200 miles of water between the Boynton Beach Inlet and Indian River. Simply, it helps the reef heal itself. My motivation is that I want the children to have something as close as I can give them to what I had growing up here as a child. 2 years ago, his environmental work would have to be put on hold. The diabetic's blood flow to his left leg was restricted enough that he lost feeling in his foot, which led to ulcers. Doctors didn't give him another option. I had a nurse tell me, "Aren't you glad you got rid of that pesky leg?" Later, on his right foot, the calluses turned into ulcers. Same problem, different result. The same surgeons said they couldn't help me. They were looking to take it off. I put my IVs out and said, not happening. Enter another healer and innovator, Dr. Paul Michael in Boynton Beach, a.k.a. Dr. Save a Limb.
What Lee was able to do was say no to amputation. And that's how this story has started. When
I first met him, he said, "Are you tough?" I said, "As a government mule." And he said, "I'll see you on the table in the morning. I'll save your leg." And he did. The man has hands from God.
We took the techniques required to unblock arteries in the heart and took them all the way down to the feet. And we found that by doing that, we can combine that with wound care to salvage limbs that are lacking blood flow.
Simply put, he lets the blood back into the foot.
No different than cleaning up a reef.
The procedure is minimally invasive. It could take anywhere between 30 minutes and 2 hours. And then it's down the hall to the recovery room where a patient will spend up to 2 hours here. After that, it's weekly visits to the wound center at JFK Medical Center.
Wound care is the key, wound care.
Dr. Tina Hansen-McCoy is a podiatrist. She helped Lee's foot heal.
For him, one of the challenging was keeping him, away from the water, keeping him away from the boat. So that was kind of his hurdle, but he did it.
When a patient loses a limb, it's often the beginning of the end. Dr. Michael says half the patients die within 2 years of an amputation. Lee was close to becoming a double amputee.
I wouldn't be here. I literally would not be here if I did not have this leg.
Unfortunately, what a patient may hear is we've done our best or you have no options. And that's why we're talking right now, is to be able to tell patients at the community level that they have options.
The main reason I'm here is to keep at least one person from going down the rough road that I went down.
And Lee's work on our waterways wasn't done yet.
He wanted to see me continue my mission that I've been on for over 15 years, for clean water and more sea life for the children.
In West Palm Beach, Andrew Lofholm, CBS 12 News.